This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.
Yeah, the numbers are really staggering in our country. The number of people who are addicted, more and more becoming addicted to many different things, many different substances and more. We're going to talk about that today, and that is through the lens and the help of somebody that has an amazing intensive outpatient treatment center in California. And this is a gentleman who can relate to all of us, came from some challenges way back when, has a fantastic book that we're going to get to, and essentially, I'm going to read the title of the book because it says everything, from dumpster to doctor.
Yes.
Dumpster is where he was essentially living behind one. And it's a true story of how he pushed forward, turned that fear into freedom, and now he's helping others. He is Dr. Keith Marshall. Back on the program. How are you doing today, sir?
Great. How about yourself?
Real good. Real good. And, you know, we skimmed upon some of the stats last time we got together, and I definitely want to talk about how you evaluate somebody for addiction and what the treatment process looks like. But you've got some more stats to share. I think last time we kind of focused on alcohol. What else can you tell us?
What the reason why I think it's important that people understand what the stats are, because I don't think people are really getting a great picture of it overall. According to the Substance Abuse and Mental Health Administration, there's probably about 48 million people that they say that is of the years of 12 and older that are actually using some substance or meet the criteria for substance use. That means, like, if they were to come into treatment and be evaluated, they meet a criteria that says they're suffering some level of substance use disorder, whether it's low or moderate. And that's about 16.8% of the overall population. That's for everything. We had a little focus mostly last week on alcohol, where I said it's about 67. More accurate numbers that are up to date, because I was going off of numbers a few years ago, are probably about 9% for alcohol use. And that's still about 46% of alcohol use in the past month, according to 2024 statistic. But the reality is that you got about 340 million Americans. It's still roughly between 335, 340. It doesn't matter. Over 48 million people, they're saying, are having some sort of substance use disorder, whether that be addiction to overall. Alcohol is the biggest one. Then you, of course, have marijuana. And of course, there's others, amphetamines, cocaine, hallucinogens, but those seem to be the two big, and that comes in every category from adolescent to adulthood and then throughout adulthood. I just simply gave an overall category.
Sure.
I treat adults particularly, and there are just centers that just focus on adolescent only, just to be clear.
What do you hear, Keith, when you talk with people, maybe evaluating, starting treatment? What's coming back right now? What are people describing about life in general now?
Well, people who come into treatment are, first of all, I mean, a lot of times you'll get families that call in. Most often, the people who are suffering, I haven't done any stats on it, but I get a lot of phone calls from either parents and or loved ones of those who are struggling, because a lot of shame, I think, goes along with it. And then, but because the loved ones, I think, are getting tired. I mean, not that they don't love them, but they get really drained out. Person is an active addiction. If he's living with you, they're like a roaring lion running through your life. I mean, there could already been family disruptions and breakdowns and intimacy dysfunction, but you can best believe when someone is addicted to something, that's going to exacerbate that dysfunction and create chaos. So I'm getting more lately people who call, and then when they feel comfortable with me, they'll get their loved one on the line, to either on the line or schedule a meeting to come in and meet me. A lot of times when people read my autobiography, it's win, I guess, because I guess my pain became my purpose. People see that I can relate experientially theoretically and educationally, but it doesn't mean someone with education without having experience can't help another person. There's a little open-mindedness that has to take place here, but if someone truly hasn't suffered an addiction, I truly appreciate the fact that they're trying to grasp that reality. But if it's a phenomenon in me, then it's going to be a phenomenon. When the phenomenon of craving is what they call it, meaning why is somebody that starts can't stop? Then if I can't understand it and science can't understand it, what would anybody with any education think they could? I think the thing that makes me closer to the understanding is that I actually went through it. Doesn't make me a better class, if anything. It just simply makes my empathy level a little bit deeper.
Do you think that a lot of people are hiding their addictions, even from their families? I hear stories occasionally, even alcohol. They're able to hide it. They're able to function where many might not even know what's going on there.
For sure. I think we have a natural tendency to use defense mechanisms when something is feeling great or good to us. And we find a way to, I mean, we're not finding a way, we subconsciously go into denial because we truly don't want to let go of us. Many people who have a problem already know they really have a problem, but they really are trying to negotiate this characterological conflict, if you will, meaning that they understand that their morals and principles are being compromised by their behaviors, but somehow it's a little bit too hard to let go of. And so,
Mm.
yes, a lot of people will use longer. And if the family is highly codependent, meaning just enabling the behaviors, it can get even worse for the family and that person before a consequence, which usually it takes, force them into some level of seeking out help.
What's the process you use within your center to evaluate somebody that comes before you, and is at that point where they're asking for help?
Well, I'm rooted in 12 core principles. The very first principle is screening. And screening is really just what it means that someone is seeking out help. It is my job and my team's job to screen. A lot of times that screening can take place in person or it could take place over the phone. And the objective there is to make sure that we assess this client or patient to make sure that they are a candidate and or someone that we know we can help. And if not, we don't even get off the screening process. We follow through with a referral if it has to be referred somewhere else. For example, although we may have trained clinicians, we ideally don't take people who are suffering from psychotic disorders. I believe that a responsible program will make sure that someone with a psychotic disorder, that means that they surely can't grasp reality, schizoaffective, schizophrenia, and things like that. We understand that need a higher level of cares often, more attention. I think that there are a lot of outpatients, of course, that will focus on some mental health co-occurring disorders that deal with that. My center simply doesn't. So screening is to just truly, truly make sure that we can actually help the person based on what we are doing or what we have called ourselves to do as providers. So we screen first, but there's 12 core functions. We screen, then we conduct an intake if they come in, provide orientation, then we do a complete biopsychosocial assessment. And at that point, counseling and case management kicks in, treatment education, crisis intervention, collaborating with other professional documentation. Those are core principles of sending somebody through that if we're following core principles, there's no way to misstep and or not help someone, particularly if those principles are guiding way. So the screening makes sure that they're fit for the program, but more importantly, can we help them?
What about medical evaluation? How much of a role does that have, and is that part of the 12?
It's definitely part of the 12. When we do the biopsychosocial, actually, even before then, when we're doing the intake work, there's a health and data questionnaire. There's an infectious disease questionnaire. And then we align that, particularly in outpatient. We don't have to do that within the first 24 hours, but we follow the American Society of Addiction Medicine's protocol for that. So typically in the first 72 hours, we have somebody also medically eval. Our screening can rule in if that person needs to be detoxed or not. If a person is in an acute post-withdrawal syndrome, particularly from alcohol or a benzodiazepine, we can safely do this and make sure that over the next 3 days they get to see a medical, because the medical doctor's rule identification and diagnosis is probably the most important factor, although everybody is important, because we need to make sure there's no underlying medical conditions that could exacerbate the addiction, and or what they're doing is not causing something that could be a medical issue. So yes, it's a central part of it in the beginning, and it's an ongoing part as the process develops. Every month, at least once a month, our treatment team, we have a professional medical doctor who also specializes in addiction medicine. They get an eval and or a follow-up every month just to make sure.
Mm. So we've talked about the evaluation process, some of the stats. We haven't gotten into treatment, and I got to assume that looks different depending on somebody's situation. But can we take a look at broadly how treatment works?
Well, after someone comes in, and we do the intake, and the intake is pretty much the protocol for paper documentation and things like that, and also to assure that there's no medical issues that could rule it out. So the screening does the initial, then the intake, we get a little bit more information when we find out in the screening that the person can actually be helped by us. Everything has to start foundationally with a thorough biopsychosocial interview. And what that is where the counselor and the client meet, where the clinicians meet to truly, truly do a thorough, intensive uncovering of what from childhood to now, and covering all areas of this person's life, medical, risk factors that they could still be potentially for them to relapse. We use the American Society's Addiction Medicines protocols. We use substance intoxication issues, drug and alcohol issues, mental health, emotional and behavioral health issues, risk factors, people that they're around, the environment, and then the person-centered pieces, like where do they see themselves and where they would like to be involved in this. And then, of course, relapse potential. Those last two weren't in order, but in reality, those are the 6 steps to determine level of care. So the full biopsychosocial assessment also, we look at the cultural and spiritual implications coming from their voice. What's important, because it's also important that as we do a treatment plan, we also make sure that we are being very multicultural competent to understand how alcohol or drugs in some cultures could be seen differently than other cultures. So there's so many factors in that. Otherwise, it's not being responsible, because remember, we're there to help them. And it means that we have to know as much about them as possible to set up a treatment plan. Once the treatment plan is set up, then we address those issues with, a lot of what we do is definitely evidence-based cognitive behavioral therapy. There definitely is psychoeducation around coping skills and communication skills, because usually the drugs is really not the issue. It's the symptom, the underlying issue is the person having trouble dealing with themselves. So also seeking safety and post-traumatic stress syndrome issues, because people, whether they come from a history of trauma, we want to make sure that there's trauma-informed care, because substance use disorders all by themselves create trauma to some degree for people that they're with, and even when you're in that environment. So we address that. And then existentially, we will bring other things in as we see necessary as a team. So there's other approaches that can be used to intervene. And then we, of course, introduce them to the social support community, whether that's NAAA or other type of modalities for social interaction, so that when they leave, let's say, the intensive process of treatment, they've established relations, pro-social or healthy relationships in the community with sober people.
When you mentioned the social, I'll use the word connection to addiction, where it's more of a cultural thing. Can you give an example of that?
For example, if you look at let's say some of the indigenous population in America, on the Indian tribes or these lands that have been identified as tribal areas, the
Sure.
rate of alcoholism abuse is much, much higher. In Alaska, much, much higher. And I'm not going to, I guess this, I can't, I would rather focus on it later as I get more information why it is that way. But these are kind of, for example, so if someone, or let's say a family system where everything that they do, alcohol is central to their, let's say, festivities,
Hmm.
Christmas, Thanksgiving, and then these events are very central. How do we help a person who's in early recovery be around things that culturally it's a part of what they do, for let's say Christmas and Thanksgiving and July 4th, there's always beer and alcohol and people have grown up. That's a cultural thing, remember?
I'm glad you
So
said that. I was going to say you grew up with it. So it is kind of normal, especially in other countries. Wine is served every day. It's a
exactly.
regular thing in life.
But for the alcoholic, that's obscure. And this is the reason why family group and family interaction is central to the process. Because truthfully, once someone grasps this concept of the disease and really learn to turn their life around, those cultural things that are going on, can have less of impact and less effect. But in the beginning, it's very important that their families understand that what they're doing can create risk for relapse. And if the family is sensitive and aware that the person is having a struggle, and then they become knowledgeable, instead of pointing to them as being weak or just doing something to to not motivate them. More families become sensitive and empathetic to that, learn what codependency is.
Mm.
And unfortunately, maybe don't have any alcohol around on an event, or maybe we tell the person, this, unfortunately, you may not be able to go to this event in early recovery. Maybe go to a meeting. I know it sucks, but the truth is, addiction doesn't care. I mean, so people have to become aware. So it's always good to get family and or loved ones involved. So if that is a part of your social existence, per se, during holiday seasons, the person, particularly in early recovery, people, if they're sensitive to it, maybe they'll put the alcohol away. Maybe it's not just sitting out everywhere.
Mm.
And because it's a trigger, right? But there are many other factors in it, but that's probably one of the main things is for the bios also understand the social connection that could raise, as they call it, and under the American Society of Addiction Medicine, we have a criteria around that. It's called those environmental risk consideration. What would be something um, environmentally strong for that person that may produce risk. We address it and then we look at the best way we can provide education, training, and interventions that will help that person reduce that risk at least.
For you, and you have a best-selling book, and it really is a story of perseverance, living by a dumpster, and
Right.
eventually becoming a doctor. That's the name of the book, From Dumpster to Doctor.
Right.
You speak the truth. You've walked the journey. For you, Keith, when you were going through treatment in the very beginning, what kept you going? What did you hear in your mind from others that gave you the strength to go from the fear of not living by a dumpster, wondering what life was going to be like, to finally realizing you had freedom when you got full treatment? What kept you going?
Well, what kept me going, what keeps me going now, so much gratitude first and foremost. That I had to remember, I had been in quite a few treatment centers before I finally surrendered. So there was a lot of
Mm.
information that I learned that I just didn't, what they call, it was imprinted, but I wasn't living it out. So I intuitively knew how to handle situations which used to baffle me. I intuitively knew that I needed to work with somebody and to help somebody me do powerful introspective work to really uncover what it is that was driving me. Then we did retrospective work. Then what did I learn from it? Did I need to forgive anybody anywhere? I want to make this clear too for anybody that might hear this, that everybody forgives and or even is willing to forgive based on how they see that. I can say that counseling is responsible and therapy is a responsible way to look at. For example, some people vow to never forgive people and they stay in these resentments, right?
Mm, mm.
I'm not here to judge that. I would just simply say we stay willing to work with them. So if it takes you 10 years to forgive, but you're in process to do it, it relieves and releases you, not them. And that's the key. For me, what keeps me focused today, first of all, I don't have any more desire for it. But what keeps me focused is this may be corny to you, but this is exactly what I'm doing right now. Is being able to share my experience, strength, and hope because I'm grateful. I should be gone, not just because of the use alone, because there's a subculture that goes with drugs. You're in an environment where the danger to get hurt, the danger, remember I told you I got shot in the head and I was stabbed multiple times, not because I was a drug dealer. It was because as a result of being in this subculture. Alcohol,
You fought.
drug.
You were in a bad crowd.
Oh yeah. So
Yeah,
things come with that.
yeah. Wow.
So what keeps me going is really one word, gratitude keeps me engaged because I don't have to do that anymore.
Mm.
And I
And
built a life for myself.
you said another word too, and these are words that often are said to help us move our lives forward. But forgiveness. So, instead of holding grudges, it's been said that you need to release it. Doesn't mean you condone what somebody did to you. Somebody
Right.
might be addicted because they've been pulled down by somebody else and the way they were treated, whatever the situation may be. But with that forgiveness, I believe it also has to be the forgiveness of yourself, right?
Yes. And it's easier said than done, meaning that time is the only test for forgiveness for self because I'm doing creative and progressive things to be better at being me. So forgiveness of self comes with actions that help take care of self. Forgiveness of others comes when I start to
Mm.
realize that forgiveness for self, I start to see the limitations in others. Now, let me just say this real quickly, though, because people as kids go through some egregious things, and this could actually trigger someone to say, "Who the heck you think you are? This person did this and did that." I say this to say it. I say this again, that many people need counselor and therapy to go along the process. And if it takes years to do it or take months to do it, it is not for me to judge. But I will say this emphatically to just stay at least willing to the ideal. I know mothers who have lost sons due to gang violence or their children being hurt. I know families who've come from egregious acts where their children were raped by predators in the family. And for me to sit here and not recognize or be empathetic to that someone could be triggered by this information, I want to make that disclaimer that most people should seek counseling and therapy from licensed and certified clinicians who have theoretical understanding of maybe how to help them process. But it's very clear trauma will control your life to some degree if you don't grasp the release from it.
Mm.
Traumatic experiences are what they are. It's why they call them trauma.
Yeah. And
Yeah.
I don't
And a
minimize
lot of
anything
times
for.
forgiveness is the only way out.
uh, We could do a whole podcast on gratitude and forgiveness, I'm sure.
Yes.
We're out of time for today. Keith, thank you for your transparency and what you're doing to help others. Your website, so much great information on there about treatment. There's a blog with a lot of insight as well. Certainly details and information about your amazing book. What's your website?
The word dedicatedtreatment.com.
Mm,
www. Just simply spell out dedicatedtreatment.com. And it's just not just the website, there's a lot of information there. If a person is some dilemma, is stuck, whether it's addiction, trauma, mental health, human developmental issues,
mm,
anger, just give us a call. And if I can't help, I can promise you, you won't get off the phone without a right, decent referral from something that we investigate, because I don't lend my name out just to lend it out.
And at the very least, if you have a question, comment, whatever it might be for Keith, you can always reach us, instantfeedbacksteve@gmail.com. Keep it anonymous if you so choose. Keith, dedicatedtreatment.com. You are just that, dedicated to providing treatment to help change lives like it's changed yours. Thanks for being here today.
This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.